So the approach that we used for this book was to use the Health Leads framework to organise the chapters in the text. These are around 5 key areas of leading self, engaging systems, achieving outcomes, driving innovation, and shaping systems. From there, we looked around the country and brought together a range of highly experienced health managers, leaders and academics to actually bring this text to life. I think what's different about this book than others in the same sort of field is that there's a real wealth of online resources. Each chapter contains vignettes and case studies to help the reader understand the concepts. There are self-reflective questions to really start to get to the essence of what's important. Each chapter is concise, and there are additional resources and reading materials available for each chapter. One of the other points which I think is really important, that it's not profession specific, and we've really looked at engaging a range of different clinical and non-clinical areas to make this a text that can be used across the system. What we've been really proud of in this particular text is bringing together some content that you wouldn't otherwise find. Areas such as ethical leadership, self-awareness and emotional intelligence, exploring the values in leadership, ambiguity, critical reflective practice, creativity and visioning, being politically astute. Really important areas. We've also included chapters such as networking, influencing strategically, and also holding to account, one of the really difficult aspects of managing health services today. Also, in terms of working across the system, we've looked at leading interprofessional teams. Well, really to navigate the complexity of the industry and the national and international factors, it's not good enough just to be a good manager or a leader these days. To be successful as a manager, leader or as a health professional requires a combination of both management and leadership skills and certain aptitudes. Now, this book, Leading and Managing Health Services, an Australasian Perspective, provides a critical and concise overview of important skills, aptitudes and content areas required to successfully lead and manage in a wide range of healthcare settings, no matter where you sit in the organisational structure. We wrote this book to provide insights into the aspects of healthcare leadership and management that's applicable to the Australasian healthcare system from highly experienced healthcare managers, leaders and academics. So it doesn't matter where you sit in the organisation or whether you are a student or a manager or a leader, you will find this textbook a useful addition to your library.